All right, good afternoon, everyone, and thank you for joining us for the Senator Dave Marsden, Delegate Kate Corey, and Delegate Mark Levine's Town Hall. I will kick it over to Delegate Kate Corey to introduce herself and give remarks, followed by Senator Dave Marsden, and we'll finish with Delegate Mark Levine. This broadcast
Thank,
this town hall is being recorded. Thank you.
thank you. Thank you. Good afternoon, everyone. And I appreciate all of those who are joining us. This is an important topic. As you all know, we're concerned with the distribution of the vaccine and having it be as efficient and effective as possible. And I know that the other legislators sitting here with me right now have been receiving as many inquiries and complaints from their constituents as I have. And I'm hoping that today we'll be able to put to rest some of those concerns and take questions away that we can answer later offline. And I forgot to say, I am Kate Corey, the delegate from the 38th District, and I'm delighted to be here today. Thank you.
Thank you, Kay. This is Senator Dave Marsden, and I represent the 37th Senate District, which stretches from the Prince William County line at Bull Run through Centerville, parts of Chantilly, Fairfax Station, Clifton, Fairfax, Burke Center, West Springfield, jumping the Beltway over to Annandale out into the Falls Church area and Lake Barcroft, which is where I share precincts with Delegate Corey. The one thing I wanted to start with, and then I'll turn it over to Mark Levine, and then I will introduce our speakers today. I had the experience of receiving the vaccine in Richmond on Thursday, and it was beautifully organized. I showed up about 10 minutes early for my 10:15 appointment, stood in line for just a few moments. They ushered in about 20 or 25 of us who were at the 10:15 time slot. Went inside, there were to a staging area where volunteers had links that we could put our cell phone cameras up to, which took us to the website because we had to have our survey taken within 24 hours. We took the survey very quickly. It was affirmed, went over, registered that I had an appointment, got in a line. They assigned me a table. And it took about 6 minutes at the table with a doctor who asked questions, filled out the computer form, filled out my paper card. And I asked him, I said, how long does it usually take? He said, yeah, 5 to 7 minutes. So this isn't 1953 with the polio vaccine where you can have a whole bunch of kids lined up and just be putting needles in arms. There's a little bit more that goes into this. But when I finished, I went over to a staging area where, again, someone held up a sign that I could put my camera up against to get a link, and was able to set my next appointment, which I got on the third try. So whoever is responsible for the Richmond area organization of this, kudos. It was very well done, and I'm hoping that will continue. And so with that, I wanted to introduce Delegate Mark Levine, my friend from Arlington. Mark?
Thank you, Senator Marsden and Delegate Corey. For those of you who know me, know I represent Alexandria, Arlington, and Fairfax County. We had a terrific town hall last week that had featured Dr. Avula, who's going to be introduced shortly. He is the Virginia vaccine czar. He has a different title, but that's what I call him. And he probably has the most difficult job in the Commonwealth of Virginia. So we had a great town hall focused on the city of Alexandria. If anyone here is from Arlington County, we're having a town hall focused on Arlington. We're going to have Dr. Avula back again, along with the Director of Health for Arlington. And that's going to be at 3 p.m. today. Please join us for that. You're welcome to stay here, of course, but if you have Arlington County specific questions, you're definitely going to want to tune in at 3 p.m. This is focused on Fairfax County. I want to thank Delegate Corey and Senator Marsden for joining us. And let me say this, I've heard you, I've gotten all your emails. We know that many, many, many more people want vaccine than there's vaccine available. And so we know that's true. A lot of this, most of it, dare I say almost all of it, is due to the federal government and the incompetence of the prior presidential administration. I know Dr. Avula is working as hard as he can. I also know that Virginia looks like it's behind to some extent because of laggard data entry, but it doesn't mean that there's a bunch of vials of vaccine sitting around. They just aren't. We don't have enough vaccine. Dr. Avula will give you all the details, but that's the heart of the problem. It's not that we don't have sufficient inoculators. It's not that we don't have places to do it. It's that we just don't have enough vaccine. That's the bottom line. And I'm sure Dr. Avula will give you all the details. So thank
Right.
you.
And Senator Marsden, I'm sorry, but before you make formal introductions, I just want to add that what I hear is lack of information, confusion and lack of information. What's going on? What can you tell us? How can you update us? Can you answer this question? Can you answer that question? And our caucus has had several meetings with the governor's representatives this past week, where we finally drove home the need for regular communications, not unlike the communications that we had with the weekly or bi-weekly press conferences with the governor at the beginning of this COVID emergency. So that's my way of saying your representatives are going to be sure that you have regular updates, and you may not like the answers, but you'll get all of them. And with that, I want to turn over to Senator Dave Marsden.
Thank you, Kay. Thank you, Mark. Communications has been probably just as much of a difficulty here as the actual planning and administration of the vaccine program. People get their information from many different sources, and sometimes it's conflicting. And remember, folks, this is an ongoing, changing environment. What is accurate one day may not be accurate tomorrow as we work our way through this. But I really have a sense now that we're beginning to settle into a steady stream of ever increasing vaccines and a system that will work for all of us. So with that, I want to introduce Dr. Danny Avula, who is Director of Richmond City and Henrico County Health Departments. Henrico is a county just north and east of the city of Richmond. And he's also the Virginia COVID-19 Vaccine Distribution Coordinator appointed by the governor. Dr. Avula, thank you for being here. And following Dr. Avula will be Dr. Gloria Addo and Yusu, who is the Director of Health for Fairfax County, Virginia, our home county. Thank you, Doctor, for being here with us today. We really appreciate your willingness to help communicate with our citizens. So wanted to start with you, Dr. Avula, and if you could give us a status update on where we are with vaccinations.
Thank you so much, Senator Marsden, and to all of you. Happy to be here. I just need to say two quick things. One, thank you for the shout out about our Richmond event that you attended. That is the incredible people of the Richmond and Henrico Health District that, and I've gotten a lot of feedback. Super proud of our team who's on the ground and allowing me to step into the state role temporarily. But also, when you mentioned Lake Barcroft, I went to Belvedere Elementary. And so I spent many a day hanging out with friends on the shores of that lake, and just a flood of nostalgia came back. So thank you for that. All right, well, I am going to just share a couple of slides with you all real quick, because I do think that you know what Delegate Levine shared about what is actually going on in Virginia is really helpful, and I need to just fully admit that has not been clearly communicated. I've been in this role for about 2 weeks and 2 days now, and I think have clearly seen the gap of information, and what that's allowed is for kind of the top line numbers to drive the narrative. And while we have to fix the numbers, we've got to fix the data and be able to tell a more accurate story of what's happening in Virginia. Yeah, I think it is also a bleak situation in terms of what we're facing for the next few weeks. So let me just kind of hit the high points with you all. Here's where we are today. We have just over 1 million doses that have been distributed, and as of yesterday have 443,000 doses that are showing up in our system as administered. And I say showing up in our system because there is a process of data kind of porting that has to happen once somebody has actually received the vaccine and gotten their shot, and then that data gets entered in somewhere and then ported to the Virginia Immunization Information System. VIS is the state database we use. There's generally a lag that we would expect to see. And so, as you look at this gap and you say, gosh, what's going on with all 560,000 doses? Some of that is stuff that we've got to sort out. There are systems that aren't talking to each other. There's some manual data entry that needs to happen, and we pressed into that this last week. So I expect that this gap will start to close very shortly. Some of it is vaccines that have been received this week and are scheduled for events that are coming up in the coming week. And then some portion of this is vaccines that have been distributed as second doses and are scheduled for, and they're kind of reserved for second dose appointments in the coming 1 to 2 weeks. And so I think one of the things we are planning to do is how do we break this down on our public facing dashboard? So this is all public information. It is on our VDH website. And I can pop that in the link when I'm done here. But how do we clearly explain where the vaccine is? And so I don't want to understate the importance and the urgency for me to fix the data issues and us to figure out how to close this gap. But there is always going to be a certain amount of gap that you expect, because if you get 150,000 new doses a week, it's going to take time for those doses to actually be administered in upcoming events. So let's look at that. The three ways that I'm thinking about our path forward with vaccination: one, we've got to close the gap for some of the reasons I just described. Two, we've got to manage the supply-demand mismatch moving forward. And third, we've got to build the infrastructure for the future when supply does increase. So when we think about closing the gap, you saw that 560,000 dose delta. And right now, let me tell you just a little bit about where some of that is. So about 80,000 of those doses are a mixture of doses that have actually been administered but have not been updated in our system. So in some cases, we have more rural health departments that have done large vaccination events in places that don't have reliable internet connectivity. They use primarily paper registration as their way to do those events. And so we have about 6,000 to 7,000 paper administered events that need to be entered. We grabbed a couple of our contractors and National Guard team this week, and we dispatched them to local health departments. They're working through the weekend to do that manual data entry and get caught up. About 56,000 of that 80,000 doses are health system and other provider platforms that didn't have a data link to our state database. Now, most hospitals have electronic medical records that have been talking to our state database for years. But what happened in several of these situations is that instead of enrolling their staff as patients in their standard EMR, so Epic or Cerner, if any of you are familiar with those, they use their occupational health electronic record platforms. And those OC health platforms did not have the data feeds built. And so there's some software fixes that are in the process of happening. We have a team from Deloitte that's helping do that troubleshooting and software patching. So again, I think over the course of next week, this gap will continue to close. Now, a big chunk of this gap is actually our long-term care facility allocation. So remember that the highest priority group for Virginia and really for the whole country was our residents and staff of nursing homes and assisted living facilities. It's where we saw just the most the greatest impact of COVID, and so where we raised the priority of ensuring that that group had access to vaccine. The federal government's plan was to contract CVS and Walgreens to go into all of those facilities one by one and do vaccination, and to do that 3 times, right? A first dose, a second dose, and then what we've also seen is that many people who were kind of wait and seers, they didn't want to go in the first round, got their first dose on the second trip, and so they've added a third dose. A third trip, sorry, not a third dose. So to date, about 60,000 individuals who are staff or residents of long-term care facilities in Virginia have been vaccinated, but that's a big gap between the 226,000 doses that have been allocated to Virginia. And so, when you look at where Virginia is, some of the headlines nationally have not been kind, because the percent of doses administered compared to what we've been allocated is pretty wide. There's this 567,000 dose delta. Delta. But if you look at doses administered, Virginia is just out, I think we're number 10 or number 11 today in the total doses administered in our community. And part of what is kind of clouding or obscuring the story here is that we've drawn down a bunch of vaccine for CVS and Walgreens to prioritize that long-term care facility population. So what we're doing is thinking about, is there a different way we need to feed that data and present this so it doesn't tell such a mismatched story? We're also, we've been on the phone with leadership from CVS and Walgreens multiple days this week, because they do need to get to the long-term care facilities and assisted living facilities and even independent living facilities faster than they are. And so we're seeing, how can we reallocate that vaccine to other pharmacies who could come and accelerate the pace of getting vaccine to those most vulnerable individuals. And then there's a big chunk of this vaccine that has gone to health systems. Remember, again, the 1A population was healthcare workers and long-term care facilities. So the first phase of dose allocation in our state was to the large health systems. And many of them vaccinated at a very high rate. If you look at our data on the public website, you'll see that, probably close to 200,000 of our 443,000 are healthcare workers. And so our health systems have actually done a great job of getting their staff. And then some of them have done a great job of pivoting outside of their staff and starting to vaccinate other healthcare workers and other partners in the community. We've had a lot of great success stories with health systems, working with health departments, working with other partners to get vaccine out of the four walls of the hospital. But there have also been challenges where the health systems weren't sure what the plan was with second doses. We've been hearing so many mixed messages from the federal government. Were we going to get second dose allocations? Was supply really going to be an issue? They just didn't know. And so in certain cases, there have been some reservation to use those doses that they've been allocated because they want to make sure they have second doses for their staff. And so we're working to reassure those partners that, hey, second doses are coming. You need to use everything you have right now. But that so hopefully this kind of at a high level explains some of what this gap that you're seeing really is coming from.
Can I just ask, there's this impression, you just showed the 400,000 gap. Some of it's data disconnect, but there's impression that there's 400,000 vaccines vials of vaccine sitting around. Is that true? Are they sitting around because they're second doses, or are they not sitting around?
Well, they're not sitting around in Virginia. So let's take the long-term care facilities. Of that 166,000 dose Delta, about 102,000 have actually just been earmarked, and they're still with the manufacturers. They actually have not been distributed. So here's one area where we probably just need to change our data feed so that there's a more accurate denominator for Virginia's data. And so we're working with CVS and Walgreens to figure out exactly what that number is and how we can be able to present that in a way that with integrity shows what has been distributed to Virginia. So that's one piece. The second piece in the health system is that a big chunk of that, 255, and that number changes every day because health systems are doing high volume vaccination. But a big chunk of that is our second doses that are reserved for, their staff who are scheduled out in the next week to 2 weeks. And I think, I was actually looking at New York's website last night, and what they've done is they've separated out their first doses allocated, first doses administered, second doses allocated, second doses administered. And that, I think that really is helpful for the public to see. So we're making some changes and revisions to the way that we present this data again, so we can tell a more nuanced picture of what is actually happening here.
I think that would be helpful. And I know you're going to continue. Just one last point, Dr. Avula. There is this impression, rightly or wrongly, that Virginia is way behind other states. It's been reported in some press outlets. I know some of this is data. Could you please reassure people, because folks are saying, where's my vaccine? Why are other states so much faster than Virginia? Please give us the truth. What exactly is going on in Virginia? Are we behind other states? Are we about where other states are? Because that's what folks are looking at, and that's why people, frankly, are very upset.
Yeah, I hear that. Absolutely, Delegate Levine. So I would say we are doing, in terms of volume of doses delivered, if you look at the actual numbers, we are 10th or 11th in total doses distributed. So, I think we're churning out vaccine. We have the vehicles to get vaccine out. In terms of doses, doses administered to the total number of doses that have been allotted for Virginia, there is a gap, and that's explained by the data that needs to be fixed. And again, that's one of our highest priorities this week. And the federal pharmacy allocation that we're still working through exactly how to understand how much of that vaccine is at the manufacturer versus here in Virginia. So, but by and large, there is not vaccine sitting on shelves that should be used for new individuals. Most of the vaccine that's in reserve is for upcoming clinics, and many of those are for second dose clinics. So, you know, what's the next phase of the work? It really is navigating this current supply and demand. So right now in Virginia, we are getting 105,000 new doses a week, not a day, a week. So what we've done, what we've shifted to this week is a geographic per capita distribution. And so here's what it looks like by region. I have this split out, and I can send it to you by health district. But basically, you know, when you look at some of the less populous parts of our state, you see that the weekly distribution are actually really small. So, you know, for Richmond, we're about 225,000 people in the city, and then Henrico is another 340,000 in the county. But for the city alone, they're about 2.8% of the state's population, not quite 2.5%. They're going to get 2,500 doses for the entire week for the health department, the hospital, the providers and pharmacies. And that just does, I mean, we could do 2,500 in a day at the event that Senator Marsden noted. You know, we really have the capacity to do 2,500 doses a day. And that has happened up in Fairfax County and Arlington in different mass vaccination scenarios. So I think what I hope people come away with is our allocation, our supply from the federal government is woefully inadequate. We do have tons of capacity to get it out there through our health departments, our health systems, and then to a lesser degree to providers and pharmacies. I mean, they have the capacity, but they're not getting the vaccine right now. And so for likely the next 2 months, this is going to be the scenario where we have 105,000 doses a week to distribute around the state, and much, much, much more demand. And that demand is largely created by this, you know, the move into 1B. You know, remember, we were in 1A for a couple of weeks. Some parts of our state, including Northern Virginia, got through their 1A demand relatively quickly. And so instead of holding hospitals and health departments back, restricting that funnel too much, we were encouraged by the federal government to open it up, move to 1B, get vaccine out as quickly as you can. The other thing that happened was that about 2 weeks ago, maybe a week and a half ago, the federal government gave clear guidance to all of the states. Hey, you need to open up 1B. You need to add 65 and ups and those with underlying conditions. And that was done in a context where the federal government also said, we are going to release a bunch of our second dose reserves. We're going to flood the communities with vaccine. And so we had some degree of, hope or assurance that we were going to have a lot more vaccine to be able to meet the expansion of 65 and up and those with underlying conditions. 24 hours after Virginia made the decision to do that, the messaging changed again. Actually, there aren't second dose reserves, and what you've been getting for the last couple of weeks is what you can count on getting for the next 2 months or so. And that was deeply disheartening, because trying to distribute 105,000 doses a week around the state, when you now have a 1A and 1B population that makes up like 50% of our state's population, it's an impossible challenge. And so what we at the state level now are working on is, how do we narrow this funnel? How do we refine our 1B so that people have realistic expectations about when they may be able to get vaccinated? Because right now, so many people fall into 1B and they're like, where do I go? How do I get vaccinated? And that's, I think because things have been shifting and moving so quickly, we've got to do a better job of saying, okay, folks who are, one of the essential worker tiers, let's take grocery store workers. Yes, that's an essential worker, an essential function for our society, but given our current supply, it may be 2 to 3 months before we actually get to grocery workers. So I acknowledge that is clear guidance that the state needs to be giving to local leaders, to local elected and state elected officials, and to our local health departments. And I expect that to come early this week.
Dr. Avua,
yeah.
Let me interrupt you for a moment.
Of course.
Even though I have asked everyone to save their questions to the end, I see several of my constituents are asking if you would please address the vaccination procedures at the Department of Corrections. Doesn't have to be in the middle of your presentation, but would you please do that during this town hall?
Yeah, absolutely. I'll
Thank you.
real quick is, so remember, so this week our allocation was 105,000. What we did was we took 5,000 doses off the top, and that went directly to the Department of Corrections. So they are, because part of our charge as health departments was to work through this here. Actually, I think on my next slide, to work through this phase 1B in depth on 2 parallel tracks. One, to prioritize individuals who are 65 and older and those with underlying conditions on one track. And then on a second track, to systematically work through these frontline essential workers in order. So first to get with police, fire, and hazmat, second to corrections and homeless workers, third to childcare and teachers. And I think, as I've talked to many of our local health directors, that charge was not super clear. And I think, so I get that in some communities, local leaders have said, you know what, we've got to get our kids back in school. We've got to get our teachers vaccinated. And those folks kind of jumped to the front. And so, I think that kind of variability from district to district happened without clear guidance from the top. And so, again, we need to refine this both so that our local leaders and local health departments know how to appropriately allocate the small amounts of vaccine they're getting each week, but also so the residents of our community can have realistic expectations about when we're going to be able to get with them. So to Delegate Corey, to your question, like I said, this week we took 5,000 doses off of the top of our allocation, sent that to the Department of Corrections, and that, so for at least the state-run correctional facilities, staff and inmates will have, they will be prioritizing that essential personnel approach. All right, so what's the next phase of the work moving forward? It really is about scaling up for the point at which we receive more vaccine. I'm hopeful that come late March, early April, not only will we have increased production of Moderna and Pfizer, but we will also hopefully have the introduction of new vaccines in AstraZeneca and Johnson & Johnson that are in their current the phase 3 clinical trials. And so as they wrap up clinical trials and get their data to the FDA, I'm hoping that we will see a significant increase in supply. I realistically, I don't think that's going to happen any sooner than 2 months. We'll see. Dr. Fauci announced, I don't know, 3 or 4 days ago that we're talking about weeks, not months, but no clear guideline there. But what it does mean for us in Virginia is that whenever that happens, we've got to be ready to have as many channels as possible to get the vaccine out as quickly as possible. And so this is currently what it looks like. Most of our vaccine is right now going through our hospitals and health systems and health districts, sorry. And then we have a number of pharmacies and other private providers, multi-specialty groups, family practice groups that have gone through the process to be approved vaccinators. Right now in Virginia, about 400 total pharmacies are now approved vaccinators, and about 2,000 out of about 3,800 providers who have applied to be vaccinators have been approved. So we do have this growing infrastructure to channel vaccine to when we have supply, and then to ensure that we have enough really to get to that 50,000 dose a day goal. We are also planning 10 to 12 fixed site mass vaccination centers across the state that would be staffed by the National Guard and provide 7-day a week, high output, 1,000 to 2,000 person a day vaccine delivery. Right now, that's not needed. Like we don't have anywhere near the vaccine to feed that kind of mechanism. And frankly, our health departments and health systems, often in collaboration, are doing that and better in many parts of our state. But if we do get to a point where we have, 50,000 doses a day, 250,000 doses a week coming in, we will need all 5 of these channels. And so we're building that out so that we are ready when that comes. So that's kind of the big overview. Happy to hand off to my friend and colleague, Dr. Gloria, or take questions, however you want to do it, Delegate Corey.
Thank you very much, Dr. Avila. This is Senator Dave Marsden again. And we're going to save questions for the end, but we've sort of had the 15,000 foot picture, and now we're going to bring it down to 1,000 feet with Dr. Gloria Addo and Yusu. And Dr. Yusu, if you could take it from here, from the Fairfax County standpoint, then I think we'll have a kind of a balanced picture of what's going on throughout the Commonwealth. And then we can take our questions from there. A lot of the questions are undoubtedly duplicates. So hopefully we will have either answered some of them, or we'll be able to kind of double up when the time comes with questions. But after we deal with written questions, if there's time left, we can do, we'll take some live questions. And if not, if you can leave your questions in the chat room or email Delegate Corey, Delegate Levine, or myself, we will get back to you with an answer. So with that, Doctor, the floor is yours.
Thank you. Good afternoon. Thank you for the opportunity to participate in this meeting. So here at the Fairfax County Health Department, we're currently vaccinating priority groups in 1A and 1B, specifically adults 65 and older, people aged 16 and through 64 with high-risk medical conditions or disability that increases their risk of severe illness from COVID. And then any stragglers from the healthcare personnel group that were part of 1A. Eligible individuals can register online. People who need assistance with registration or who need to register in another language or who do not have the proper internet access or technology for online registration can contact our call center to register over the phone. And that number is 703-324-7404. It's open Monday through Friday from 9 a.m. to 7 p.m. and on Saturday and Sunday from 9:30 a.m. to 5 p.m. So currently, and I haven't checked today, but as of yesterday, we had more than 132,000 people who had registered for a vaccination appointment. So the health department, so it is a two-step process where people go in and sort of register for an appointment. And as time goes on, when we have availability, they are sent, we send invitations to a group of people with different times that they can actually schedule an appointment. And then that's how we've been doing it. The health department is scheduling appointments for vaccinations at 5 sites around the county, Tuesday through Saturday. And we also will make accommodations for those with mobility and other issues. So far, the health department has vaccinated a total of 30,000. This was as of yesterday. We vaccinated a total of 30,169 individuals. And so these include healthcare workers, frontline essential personnel, and others. Today at the government center, so the way it works is Tuesday through Friday, we have the clinics in our district offices. There are 5 district offices in Fairfax County, and we've consolidated all the work that happens in the 5 into one office to do our routine public health work. And then the other 4 are now our vaccination clinics. And then on Saturday, we have mass vaccination clinics there at the government center. The capacity there, the first time we did about 44 or 4,500 people. Last week, as we started doing our elderly, we sort of slowed down a bit just to get a feel for how quickly we can move our elderly population through. We don't want to have any accidents. Unfortunately, we had a couple of falls last week, and so we're really looking at that throughput. Today, I think we scheduled 3,000. So we continue to ramp up our throughput. On average, we're vaccinating about 10,000 people a week at this point. And so we are also working with our partners, Adenova, our pharmacies, Safeway and Giant, and our community providers to increase our capacity should the time come when we have enough vaccine. As you heard from Dr. Abula, vaccine supplies remain extremely limited while our demand continues to grow. You also heard from him that over the next few weeks, we'll be receiving a total VDH and as a whole will be receiving about 105,000 doses each week, and that they'll be using a per capita distribution to jurisdictions. So for us, it's a little over 13,000 that we expect to have moving forward. And so we've been working, our public health team's been working to get all the available vaccines administered as quickly as possible. But it's going to take time to vaccinate all of these people in our target groups. As Dr. Abula mentioned, with the expansion of 1B, that is about 50% of the Fairfax community. That's 500,000 people at a minimum. And so we've been asking our community for patience. We've done a number of things. So sometimes we do what we call open pods, which is when we invite community to come, like we're doing today at the government center. And sometimes we've done closed pods, like with the EMS, fire and hazmat and police. We worked with the occupational health unit and provided them with vaccine after we made sure that they understood the specific unique storage requirements, the handling and the special training for the vaccinators, because these mRNA vaccines are very fragile. So you have to treat them with very delicate hands, otherwise you end up ruining it. So once we work with groups like that, and we see that they're able to vaccinate themselves because they have a whole, they have clinicians and nurses and so on. We do these closed pods. So we've done that with our public safety. We did that with our adult detention center, and so those are the two options that we currently are using. So at this point, I will maybe see if there are any other questions.
Doctor, thank you very much. This is Dave Marston. Really appreciate the more localized report. Now, I think where we will go is Allison Lawrence, who is in Richmond and works for the Senate Democratic Caucus, has a number of questions that have been pre-submitted. And Allison, if you could kick us off there with questions for Dr. Avula and Dr. Enyensu, and we'll see if we can work our way through these questions. Allison, floor is yours.
Thank you so much, Senator Marsden. And again, thank you to everyone who pre-submitted questions, who have submitted questions in our Q&A tool. We have 35 and counting, and also those in the chat. There are some duplicates, so we're going to try to get to as many of you as possible. So if we do not, our members will follow up with you offline. The first question is, well, first is a thank you, and it comes from Chris Falcon, who is a constituent of Delegate Kate Corey and Senator Marsden. Many of us essential public safety employees that are needed for the continuity of government are waiting for the vaccine as a part of Group 1B. When can we expect to get this group? Also, if we live in Fairfax County, but are employed in a neighboring Virginia county, such as Arlington, should we get in line with both? The Fairfax County website does not appear to be allowing this group to pre-register at this time. Thank you.
Thank you. So at this time, we are not allowing anyone beyond the 65 through 70, and so those with underlying medical conditions and the 65 plus. And then obviously the healthcare personnel who've been already in the vaccination priority from the start. They are the only ones that are currently able to make appointments or actually to register. That is a huge chunk of people. So it's going to take us a while, and we don't want to just have people queued up. As we go through this priority group, we will be opening it up to other groups. But the continuity of government folks are at the bottom of that 1B prioritization list. And we're supposed to go through that list as they appear in order. So it is gonna be a while before we get to that before we get to that group.
All right, thank you so much. The next question comes from Ms. Liz Bailey in Annandale, and it has to do with what happens after you've been successful in registering on the county's list. Is there anything we can do to check on that registration? We've received a confirmation email that says we're on the list, but do we have any options other than simply waiting to be contacted by the Fairfax County Health Department?
So periodically you will, so let me assure you, everyone who is has received that message, please rest assured that you are in queue. Your place in queue will not change, and that periodically you might get you will get a message just to let you know that you are in queue. We are not, you will not get an opportunity to register for an appointment until fairly close to the time. So whether it's first dose or second dose. So for example, this past couple of days, I got, I did my first dose on the earlier on in the month, and my due date for the second one is on the 27th. So all of a sudden, 2 days ago, I get an email and it has a few dates around the 27th for me to pick for my second dose. That's the way it will be. So please rest assured, your place is in queue. You will get that email with a number of appointments at different sites that you can choose from. And once you do choose that, you will get a confirmation back so that you with instructions and so on. So I hope you will trust that your place is secure. If you're listening to the news a few days ago, I guess, and then previously when we opened up 1B, our phones crashed, our systems crashed. And that's because in a very short period of time, we got over 1 million calls. People were calling and hanging up because the lines were busy. I'm hoping that you will refrain from doing that and trust that we will get back to you when the time comes. As I said, we have over 130 people in queue. I don't know where you are in the queue, but the vaccine supplies are not a lot. So just thinking about the fact that we are doing about 10,000 or so, and we will, moving forward, we will have to share the vaccines that we have with Innova and our other partners as well, because they also have people in the pipeline. So we ask for your patience. It is going to take some time, but we will get to you for sure.
Dr. Adeoyenso, I'm curious if people have signed up for the vaccine, they've registered with you. Do you make any distinction? Is it first come, first served? Or let's say someone who's 66 signs up and the next day someone who's 96 signs up. Are you going to put the person who's 96 ahead of the person who's 66 based on need?
No, right now it is first come, first served. So automatically they release blocks of individuals at a time. So let's say we Monday through Tuesday through Thursday, they'll release maybe the next, let's say 5,000 people to actually try to force them to utilize that time frame. We don't want to have any gaps in the appointment. We want it to be 100% full. So that's the way it's released. And then they see after 2 or 3 days of releasing that, if it doesn't get full, then they release some more people to make sure that block gets full. And then we go to a Saturday. If you don't respond, you don't get kicked out. You just will be part of a next group of blocks of people that actually receive an invite.
So doctor, you don't have any vaccine in storage where you're waiting. Every single vaccine you have, the moment you get it, you connect it with someone to give them an appointment.
Oh, no, we couldn't do that. So actually, we have enough for the next, let's say, it's hard to open up a schedule when you don't know you have the vaccine on hand. So we need to make sure, otherwise people will be angry with us for scheduling them only to tell them that they can't come in. So we have it for about a week or so we can open up the whole week at a time.
So you only have about a week's supply of vaccine available.
I think right now so obviously we have second doses, so those are separate. They come separately, and I think we have about maybe 8 or 9 days worth of vaccine available. Today, for example, I think today we had a little over 3,300 or so people that had registered for today's clinic. And as I said, we purposefully capped it after what happened last week. And as we're working with our seniors, we just want it to be a safe environment. But in earlier Saturdays, we actually did 4,300. So we hope to get back there maybe in a week or so after we learn a few lessons from today.
And you're putting second doses aside so that folks who get their first dose can be guaranteed to get their second dose, or are you using some of the second doses as first dose?
No, we don't. The second doses come. So it's all been figured out. So as VDH sends us vaccine, they know that it's time to send 4,000 doses, second doses, and it'll come separate. We'll have our first dose shipment and then a separate one for second doses. And those get used up because the people need to be vaccinated, as well. So we are now beginning our second doses. We started this week. And so now it's really going to be a challenge, which is why we are bringing on other partners so that it doesn't slow us down, because we need to do the second doses and we need to do the first doses as well.
So, sorry, go ahead, Allison.
Yes, that's what I was going to say. Please continue reading the questions. Thank you.
Yes, thank you very much. This comes from Mark Donert. He would like to know, when can we expect to see one or more of the vaccines distributed to physician offices and drugstores to administer to patients and customers rather than have the county doing it all? If so, when?
That is an excellent question, and that is our desire, actually. If you think about it, that we have limited vaccines and we have high demand. The way we're doing it, it's hard. I mean, ours is a first come, first serve, but we know that not all 65-year-olds are the same, not all 85-year-olds are the same, and that the private docs in our community are the ones who really know, in terms of prioritization with limited resources, who should really get the vaccine first. Because we don't know, the people who are signing up, we're just doing it on a first come, first serve basis. We worked with community providers several months ago to make sure that they could send in their letter of intent. And as Dr. Abula spoke about earlier, not all of the of those applications have been approved, and without approval, community physicians cannot start vaccinating in their own clinics. So we are, we do have staff that we actually hired just to engage with our community providers, and as the applications become complete, then we'll be working with providers to also bring them into the mix. But that cannot happen when we are just when we just have 105,000 for all of Virginia. It is, as Dr. Abula talked about, these are plans. We're working to build capacity so that beyond the health department, so that when vaccine becomes available, it'll be out there. In the immediate future, though, we are enlisting Safeway and Giant to help us with our with our points of dispensing, which are the large vaccination clinics that I talked about.
All right, thank you. The next question comes from Mr. James Bailey of Annandale, Who makes the decision on the priority of who makes the decision on the priority of those with significant pre-existing conditions when it comes to further vaccinations? And how does one indicate what are those pre-existing conditions?
So we are currently in Fairfax, at least, we're also taking registrations for people with people who are 16 to 64 with a high risk medical condition or disability. This is, as if you've been on a website to register, it is a self-attestation. We did the same thing during H1N1. That's the best we can do. So we ask people to self-attest after we've asked a few questions about eligibility to make sure that it is factual. And then we have people on our team that evaluate these registrations to look for inconsistencies and so on. But unless an inconsistency is identified, we take people at their word. And again, they're all at the same level of priority. It is just a first come, first served basis through the health department.
Thank you. Candace Butler submitted a number of questions, many of which were answered in your presentations. So we do have a few more that we were sent in, which get very specific. And I'll let the members follow up individually, but I'd like to get to some of the participants who've joined us live as well. And I think Zoe Aquino has a very good question. And it is, how can non-English, non-Spanish speaking communities receive assistance in navigating this process of signing up for vaccines if they do not have English speaking people in proximity to assist them, especially if they are 75 plus and have a higher chance of illiteracy and difficulty with technology?
Thank you for that question. As I said earlier, you can either register online. However, people who need assistance with registration, people who need to register in another language, people who don't have access to technology and so on, they can call our call center to register over the phone. And that number, I'll give it again, is 703-324-7404. 703-324-7404. And the hours of operation of that hotline is 9 a.m. through 7 p.m. Monday through Friday, and 9:30 a.m. through 5 p.m. on Saturday and Sunday.
All right, thank you. The next question will come from, let's see. Susan Clark. I registered and got an email about scheduling an appointment, but when I tried to schedule, the response was no appointment available. Will I get another appointment? So
definitely yes.
Answered that, but yes. Deborah Levis. Some of us are Kaiser patients and they seem to be running behind the Fairfax focus. In my last conversation, they said they're just inoculating ages 75 plus. Should we also register with Fairfax County? So we're getting a number of questions regarding should they register more than once depending on where they live. If you could address that again.
So if you're with Kaiser, I would just stick to and you've already registered with them, I would just stick with them. We actually, in the last couple of days, have been working with them and we'll be giving them some vaccine. So just stay put. I don't know where you are in their queue. If you leave that queue to join our queue, I haven't checked with our numbers today, but the last time I checked, there were already 132,000 people ahead of you, and that number grows by the minute. So don't have the what you call it, the grocery store experience. It happens to me all the time where you're on one line and you think that line is going too slowly, and you move to the other line only to see that the new line you've joined is actually worse off than the previous one. So if you're in queue with Kaiser, I would just stay there if I were you.
All right, we'll take one more question as our time is wrapping up. Lynn Sunday, why can't you have a location for either drive up or a shorter walk for the elderly and or handicap?
So that's a good question. I did say earlier on that people with mobility issues, we can accommodate them through other avenues. So if you have a mobility issue, please call the call center. Actually, is it possible for me to get this individual's name and phone number after this meeting, and I can reach out,
Yes.
please?
All right, I will turn it back over to our elected officials for closing remarks as we are about to hit.
Allison, excuse me, a question just showed up a few seconds ago. A Kaiser patient saying that Kaiser is telling him to register with Kaiser and with the county. Can you please address that, Dr. Ishu?
So I guess, I mean, if Kaiser is telling them that, people have, even within our system, we find duplicates where people have registered multiple times. So there's nothing wrong with that per se, except that it kind of clogs the system, especially for ours. If you're registered multiple times, we're able to do data cleanup and then able to eliminate the duplicates. So I mean, it doesn't really hurt. I mean, eventually, if you get your vaccine first at Kaiser, when we send you a link to make an appointment with us, it'll be a no-show and someone else will take the spot. So it's fine.
All right, again, thank you all so much for participating. We will share the chat and the Q&As with the members to do follow-ups, in addition to any emails that we did not respond to. So at this time, closing remarks from our elected officials. Thank you all again for joining us.
Allison, thank you. I would like to be able to assure those who are listening today, participating today, that we are recording this so that we can attach it to our Facebook pages and newsletters, etc. And people can watch us and say, why did you make such a face when Allison said whatever it was? So be prepared for that. But I just can't thank our medical specialists enough for visiting with us today, and your patience and your clear explanations are exactly what I was hoping for. I'm afraid that we're going to have to do this again, Dave and Mark, maybe even more than one again, because the questions will keep coming and the situations will keep changing. So thank you, fellow legislators, and I'll see you in this format again. Hope you all have a really good day. Take care.
Thank you, Kay. And let me give out my cell phone number, which is 703-964-6821. You can call me with any personal issues or questions that you might have, and we will get right with you. And thank you again to our health professionals who are with us today. It's a tough job, and just imagine having to do all of this planning and all of this organizing and all of this work in a situation where everybody's in their own home and can't sit around a conference table to do this. It's just extraordinary effort that's gone into this. I think many of you on the call have experienced it in your own professions and know the challenges that have been. But this is Virginia. This is the United States. we always get things right, and we'll get this we'll get this done. Thank you very much for your patience and for being on the call today. We really appreciate it. Mark, you want to close out?
Yeah.
Oh, wait a minute. Now I have to give everybody my cell phone number in case you have forgotten it. It's 703-470-4494. 703-470-4494. And yes, I really will answer. Thanks.
And our office number is 571-234-8481. We respond to any email. So send that. You can send it to Levine, DELMLEVINE @house.virginia.gov. Folks, this is frustrating. I want you to know that we hear you. It is extremely frustrating. It's frustrating because there are very high expectations and we don't have the supply. And it's not Dr. Adoyenzu, who is, I guarantee you, working 16-hour days, 7 days a week, and her entire staff is working their hearts out and have been since March. So it's not her fault. It's also not Dr. Daniavula's fault, who's just hired 10 days ago and is doing his best to get the vaccine out to every Virginia locality. There is not enough vaccine nationwide. And it's not enough vaccine nationwide, frankly, bluntly, because the Trump administration didn't order enough vaccine back when they could have last summer. You can read all about that in the New York Times. But we are where we are. We do have a competent president now, and I have no doubt that vaccines will increase. We're only getting 105,000, you heard Dr. Daniavula, a week in all of Virginia. There are 4 million people that are 65 or older or have special needs in what's now the 1B category. Do the math, folks. 4 million divided by 100,000, that's 40 weeks. That's 9 months. We started in December, we're talking about August here. So I know all of you want a vaccine. I'd like a vaccine. I don't have one. I'm not putting my name in because there are people older than me and in more need than me, and I'm letting them go first. But so it's really hard to tell people to be patient when we've all been patient 10 months waiting for this. So I do hear the frustration. I know it's there, and I'm sorry, it's just the hard truth. If you sign up, you heard Dr. Adoyenzu, it's gonna be first come, first serve. They're giving about 10,000 out a week, and they got 130,000 people signed up so far. Again, do the math, that's 13 weeks. We hope the pace will increase, but we gotta be honest with you, not to have unrealistic expectations. And we're just trying to convey that message. And we really hope that the President Biden and new vaccines, that this will step up, that we're not gonna have to wait till August. But please understand, it's not that we don't have inoculators and we don't have nursing students and we don't have capacity. All of that exists. We don't have vaccine. Without vaccine, we can't vaccinate you. That's the blunt, hard truth. And I just want to convey it from the heart. And I know Dr. Adoyenzu had something else she wanted to say before we close.
Well, can I ask you a question? Sorry, Dr. Gloria. I just wanted to know, is there a way that people can communicate if they're with you about their appointment, if their status changes, if someone becomes seriously ill after they've registered, or if in fact they have gotten vaccinated in another jurisdiction? Is there any other way besides that one phone number to communicate with you about that?
You mean if somebody's status changes
Yes.
and they don't?
If they need their appointment sooner or they don't need it.
So if they need the appointment sooner, and unfortunately that, sooner because, if you're ill, then it is just too late, but if someone needs to get off the rolls, they can go back in and cancel the appointment. In fact, if you look on our website, we do ask that as you register, if you no longer need it, that's fine. What will actually happen is these invitations will go out a few times, and if you don't respond, then you might lose it. But you don't lose it just on the first try. We just kind of keep you in the system for a while, and eventually we will realize that you are not interested. And as I said, we don't hold just one slot for one person. we send out, for example, 5,000 people invitations at a time because we have that many slots. They pick it up and then we send more and until we're done for that week. So my office telephone number is 703-246-2479. Anyone can call that number. I'm especially interested in the individual who had mobility issues. Please call me. We have an alternative way for people with mobility issues. So please call us and we'll be able to take care of you. The one thing I wanted to leave off with is, when we focus so much on the lack of availability of vaccines, it's almost as if, it is as if there's nothing more that we can do. There's a whole lot more we can do. We've been at this for almost a year. The public health messaging, the public health measures that we've been practicing has brought us this far, and they're very effective. Physical distancing, the 6-foot physical distancing is still important that we continue to do that. Wearing of our face coverings, also very important. Hand washing, the cleaning of surfaces, avoiding crowds and all those things. Those are very important. If we hadn't done those things, the numbers would have been much worse. So it is working. So I don't want us to feel that because we haven't gotten our vaccine, we just throw up our hands in the air and just get feel like there's just nothing more for us to do. There's a lot we can do. Our health is in our hands. We say that, but it's figuratively and literally. And if we don't faint and continue to do those things that we've been doing up until now, it will keep us safe until we get our vaccine. So thank you so much for the opportunity to join me today.
Thank you, Doctor. And thank you, Allison, for organizing this and emceeing the event and getting the questions answered. So with that, we'll end the call, and God bless everybody and hang in there. We'll get this done.
Thank you.
Have a great weekend.